Good afternoon. This is Dr. Bill White again with the American Orthodontic Society. And I hope that each of you, if you're not in a group like this, join the American Orthodontic Society. And they'll teach you things to do that you wouldn't think about. Now, let's get on with this. I want to talk about ectopic eruption. We've discussed this before, but I think there's some things that we need to talk about a little bit more in doing this, and its results if not treated. What is the results of ectopic eruption? And I'll tell you, it's difficult to come out of one without extracting some teeth maybe that you didn't want to take out. So anyway, let's get on and talk about this young lady that I had came in, and is a real perfect example of ectopic eruption. This situation, the ectopically erupting 6-year molar on the, I think it's on the lower, maybe the lower right side, I'm not exactly sure right now, and had a beautiful smile. Nothing wrong there, nothing wrong with the facial structure, anything. Just this tooth is coming in wrong. And that's what I want everybody that's working on kids to definitely know about ectopic erupting teeth. And now, in her case, she had a little depth of the bite that was more than we wanted, so we'll try to kind of open that up too, because the 6-year molar wasn't touching back there in the back on this side. And we have a spring already in there, but I'm going to show you exactly how we made the spring and how you put it in there. And people talk about when should you start doing orthodontics on kids, you know. That's a silly question. That's like, if they have a cavity, you're not going to sit around and wait till they're 14 or 12 or something to fill the cavity. You fill the cavity then. And so when you have other orthodontic problems, you think of them in the same manner. I hope that this gets across to the general public. Now here is the ectopically erupting 6-year molar, and this tooth is headed down at about this angle like this. And the erupting 6-year molar has a follicle around it, and in that follicle there are absorptive cells that eat away the roots of the baby tooth. Now this baby tooth that's sitting right here had at one time some roots coming out, probably spread out kind of like this, and this follicular kind of a ball that the tooth is in, and as the tooth comes through, this epithelial tissue becomes around the protective tissue around the neck of the tooth like this. Now, here we'll see that these cells actually eat this root away, and they'll come up. I mean, this whole root is gone when you look at it, and it's fixing to get over here on this root, on the mesial root of it. Let's look at the x-ray that'll explain that a little closer than this. Now we put this spring in there, and this spring is a rectangular wire, and it's in a tube that's on the side of this tooth, put in, and you can only put it in with about this much activity, and then you bend this little hook you see right here. Now you bring this up and hook it over this wire. You don't even need brackets. I could have just bonded this wire to the tooth, and this tooth right here, and this one right over here, which we did here. You don't need these two brackets. We could have done it without it. And then you bring your hook up and put it at the distal of one of the bonds. If you brought it over here, you'd need to bring it up to somewhere out. And in this area right here. Because as this tooth comes out of here, it's going to move backwards. Just watch it. The roots are down in the bone down in here, and this tooth comes out. The roots will stay pretty much where they are. They'll come forward some, and then we'll bring them forward the rest of the way. But this tooth will move back a little. It will be setting something like this in the area. And you just hook onto this and bring it up and keep some of this activation in this wire, and that brings the roots forward with the crown. We'll show that in a little more detail here in just a minute. All right, here it is from another angle, but the same thing, just this wire. I guess I should stop and draw this so people could understand a little better what this is. Like, here's the baby tooth, setting something like that. And the roots of it are usually kind of flared out, something of this nature. Not perfectly, excuse me. My nose is itching, and I have to wipe it off first. Now your enamel structure on the tooth is something like this around it, and the resorptive cells eat this part of the tooth away completely. It'll eat of it here, and the erupting tooth coming through here will start out down in here somewhere, and the bud, and it forms, it comes up, but it's leaning, and when it gets here, the crown is something like this. It's stuck under this enamel structure here. And so we come in and put a tube on here that's rectangular, and then we bend a spring that's made like that, and it goes out this way, and then we'll have the other deciduous molar in here, and maybe a deciduous cuspid up in here, and you can just bond a wire on those teeth. That's all you need. Just bond it, about an 018 wire, onto the teeth, and now you're either going to have to hook it here or here. And in this particular one, we thought hooking it back here would be just fine, and so we cut the wire, or put it in here, pull it up and see where you need to put your hook, and now you make a little hook that goes over there, and clip the rest of it off. You bring this up and hook it under this part of this, and so you'll have a wire that comes like this with a hook in that fashion. Now this wire is pushing down on this tooth, and this wire is pushing also down on the distal root of this tooth right here, and to some extent would be on this deciduous cuspid up here. It'll be pushing down on this whole wire right in here. And the force to go down has to be, it is greater than the force picking this up, except it takes a lot more force to force these teeth into the bone structure than it does to this tooth to come out of there. Now when it comes out, the roots will be, it probably won't have all the roots, but it'll have some of the root structure in here, and this tooth will lean back like that. Now watch that happen as we hook this to this. Now, and everybody that works on kids, ought to see this. If this is not treated, this resorptive cells here will eat all the root structure up, and this crown will just be sitting here, and when it's gone, this tooth is free to drift all the way up here. And it does, and it'll come over to where it's something like this, And now you've got a shortage of space going all the way around the arch here. And when you lose these, there won't be room for these two bicuspids and the cuspid to come through here. So let's, if you can kind of figure out what I'm drawing about here. But I hope you understand this. This is such an important part of pediatric dentistry, and the pediatric dentist ought to be the one doing it. You're not going to send your child to an orthodontist just for every little step in something that needs to be done immediately. When you see this forming down here and this tooth can't hit here and it's not setting in here like that, then this will eat away this whole root structure. But the tooth is still vital. It's not dead, even though the nerve and the blood vessels are eaten out in it. It's still alive when it comes through there. So let's go ahead and I'll show you what happens right here. Had a perfect case. Now here is the spring that we use. We put something on this 6-year molar. And this is after it's corrected the tooth and brought it up here. Then this is laying pretty well straight around here. But when we started, this was down here. This place here was right here somewhere. And as the tooth moved up, this wire goes back with the tooth as it moves up. I hope that people will see this. I do everything I can think about to show you exactly what is happening. See, this is bonded onto this cuspid. This is a bracket, but you didn't need a bracket. We could just bond some acrylic on this and bond acrylic on this right here and do the same thing. Now you can do this to a wisdom tooth that's trying to come in. We don't call it ectopic eruption there because the permanent wisdom tooth doesn't eat away the root of the permanent second molar or wherever it is down there. In other words, it's a very unusual thing for the follicular capsule that is in, if the cells in it, to eat away a permanent tooth. But once in a while they do. And I've had some, and I've shown you some cases of that, but it's a very rare thing. So when this comes in under a wisdom tooth or a second molar trying to get in behind a 6-year molar, do the same blooming thing, and you can upright any tooth on any body. I don't care how old they are, as long as they're alive. I really believe. Now, if the tooth is ankylosed, that's a different thing. You have to go in and crack it loose or get your oral surgeon or somebody to crack it loose so it'll move. But let's go on. We're kind of ahead of ourselves here. It's already straightened this tooth out. And this tooth at one time was sitting like something like this down here, and it's already going up there. So as it straightens up, the roots come forward a little bit, but the crown moves backwards a fair amount in doing that. Now let's erase that, and we'll go on to the next. Now here is the ectopic erupting tooth when you see it. Now, if you look closely here, you can see where I took electrosurge, and this tissue probably was over this tooth, something like that. And I went and deadened this and filtrated around it and took the electrosurge and took this tissue off the tooth right there. And it's not bleeding, and so I got this side of the tooth open, and I bonded this tube. You have to have a tube in there, and it needs to be a rectangular wire, or the round wire can roll. And this wire right here was going down here, and I might not be able to get it in because of the cheek down here, so I may have to take some of the activation out, and I pull it up and see where I need to put this little hook, and we put the hook on it, and then push this in, take this wire, bring it up and hook it over there, and now this wire looks like this right here. And I'll tell you, it doesn't, I don't care how old they are or what, that wouldn't, an adult wouldn't have this, but you could have a second molar coming in under a 6-year molar and looking virtually the same way. See, so, and you do it the same way. Now I'm going to pull this away now for a minute, and we'll go to the next film, and when we get to an x-ray, it'll show you. Now, when I saw this little girl, her mother knew us and everything, and she came with her, and I showed her where this tooth is coming around like this and coming up, and the resorptive cells have already eaten the whole distal root of this tooth off. And if you leave it, and this is so ridiculous for me, have pediatric dentists and people talking, well, when should we start? When should we do this? When, oh my God, when you see this, start it. It's time to start it. If you had seen it even starting to do this, it's time to get in there and make this tooth go back in this direction. And this is easy to do. It's easy to make that. You don't need brackets, you just bond onto the deciduous teeth around here. And you could, if you had one on both sides, you could just run a wire all the way around, bond it to the teeth, and pick both teeth up. Now watch, this tooth had some root structure. It's not completely grown yet, but it's going to come up, and it'll be sitting somewhere like this. In other words, the roots will move forward a little bit, but not all the way, and they'll be down in something like this when they're through it. And now you've got to drag it forward, so you pull it forward and keep some of this activation in it, and it'll make the roots go along with the crown. Okay, let's skip this on now, and we'll go to the next one. All right, this is part of the way through. This is just after we had it on there for a little while, and the tooth had moved back like this, and these roots had moved forward a little, but it's going to end up with this tooth being just about 1/8 of an inch away from the other tooth. And now we've got plenty of room for this bicuspid to erupt up in there, this one too, and this one too. And you won't have any trouble with this. It'll be just as good as this side over here if you get in time and start moving this ectopically erupting 6-year molar back in this case. All right, let's, let me see, go to the, somewhere I'm hung up here. Let me get my dot back again. And all right, this x-ray right here tells you almost exactly what I've been talking about. This is a tube that we put on the side of the tooth. It looks like it's on top of it, but it's not. You have to have your tube on the side of the tooth, and you can have it at an angle, but you can't put it up here. The force has to be going like this to actually pull this crown this spring right here now at one time went down like this, and we pull that up and it tightened this thing up, and it's pushing down on this real hard, and that's pushing up on this. Now this tooth up above had over erupted. Don't go in saying, oh, well, it can't have room, I'm going to have to grind this off or grind this. Leave it alone. Leave it alone. It'll come in, and as a child chews in here, this tooth will line right up with this tooth here. You don't need to grind it one bit. And just remember that. Don't just forget about grinding it. Now, if we had not gotten in here, you see the mesial root of this tooth is just about to go. So we don't have much holding that in place. So anyway, let's go on to the next slide here and see. Now there it is when we started, and this is the second deciduous molar, the first and the cuspid, and we can just bond this to that, bond this tube on it, took electrosurge, uncovered the tube, got the side of it out, bonded that tube on it, put that in, brought it up and hooked it over here, and and I'll tell you, I have never run into one that we couldn't set up. If it's ankylosed, you got to break it loose, but these haven't had a chance to get ankylosed. They never have run into one of them was ankylosed. All right, now we go to this. Here is the little hook, but it's upside down. Actually, I ought to turn this around this way. And when I activated it, I pull this down like that, and that tightens this spring up, and the spring wants to push down this way. And when it does, if you can figure in your mind, this went into the molar tube here. I've got that picture upside down. It ought to be changed the other way. All right, here it is hooked up in the mouth now, and you can see this hook was here to start with, and as this tooth moved out in this direction, this slid back here. Now there's only a mesial root holding this tooth in place. And so and I've seen people that were ridiculous, trying to put something on this tooth here with only had one part of a root and try to prise a 6-year molar backward. Well, they might as well kiss this thing by, because it's not going to hold up like that. So we put the pressure over here and that one root, and it's enough to take this tooth, shove it back here, and if the upper tooth were sitting in here and it ran into it, it'll push it up and it'll still go back. Now you keep some of this activation in and tie this to whatever you've got over here. You can put some, tie this. It'll pull the crown forward. If you don't have enough of this activation, the crown will move forward and the roots won't. If your roots move forward too much, you've got too much of this activation in it. So you can bring this tooth right up here behind that, and the case is pretty well taken care of when you do that. You keep it on there a while with almost no activation to see just how the tooth's gonna take it. And now here it is. When I saw the lady, I sat down and I drew this out for her. And I was just drawing, and I drew these brackets. I didn't need to do that, just bond a wire there, bond a tube over here, take electrosurge, open this up where you get to this tube, put this in there. Actually, I had the spring actually can be made like this when you come in there and stick this in the tube. So now when you raise this up, it tightens this up, and this works going down. So this one's upside down too right there. All right, there's the tooth when we started. This 6-year molar will eat the dental structure and the root away, and if you leave it there long enough, it'll eat everything inside the crown, and you'll have this crown sitting in here, something like this. And you see where that crown, that sharp edge is hung under this 6-year molar right there, and it can't get out of there. And if you try to go in here and put something to push this away, you'll put more load on this that it can take, and you'll lose it. So you bond something over here and you put force down here or even further out, it'll pick this tooth up. This upper 6-year molar is over erupted, and as it comes down, when they close together, this is close here. And when you start up with this will bump that and intrude it, and the occlusal surface of the teeth will be level when you get through. And you can, this tooth can be sitting in here, and you tie onto it and tie it to these. If the crown starts leaning too much, put some more of this activation on it. I don't know what's making this racket, and it'll pull it on up, and you can put that tooth right in the place where it should be. And there's no question when it should be started. Someone should have seen this and started it maybe 6 months or a year earlier if you had seen it. You knew it was going to happen. And so there that is. Let's see, I think we have another deal going here, and I've messed up my pen. And here the little girl is after we finished. And that's the end of the row. And you just keep this with some of this activation in it as you tie something on it, holding it, pulling it forward. So you pull this part, well, keep going back, but you'll pull that tooth back to this area. It'll come right back. And I'm having a lot of trouble keeping the pen up, but it'll bring this tooth right here up, right where the others are. I thank you for watching this. I hope it's down where you don't get confused in doing this. But everybody that works on kids ought to know about ectopic, the erupting teeth. And I want to go on here and invite you to join the American Orthodontic Society, and they have people that are teaching. We're going to start some of these webinars. It doesn't matter where you are. You can take these webinars and learn how to do these things if you don't. Now, many of you, this is old hat, so you can just forget it and go on and read something else or listen to something else. But anyway, this is the way to handle ectopically erupting teeth, or any tooth that's coming in and trying to get up like that. You can put that same spring on it. So I'm going to say goodbye, and we'll try to get out of here if I can find my deal. Thank you again now, and join our group and subscribe to it. Thank you now.